Question 1. The monitoring system demonstrates that an optometric technician is presented with a patient complaining of sudden onset of eye pain and a gritty sensation in their left eye after gardening. The technician has performed a preliminary visual acuity test and observed a possible foreign body on the conjunctiva. The technician is considering proceeding with removal. Which of the following actions best reflects regulatory compliance and professional practice for a certified optometric technician? Option A. Immediately attempt to remove the suspected foreign body using sterile forceps, then document the procedure and findings. Option B. Inform the patient that this situation requires an optometrist's direct attention and escort the patient to the examination room for the optometrist to assess. Option C. Ask the patient to rinse their eye with water and return in 24 hours if symptoms persist without further intervention. Option D. Administer a topical anesthetic and then attempt to remove the foreign body, followed by a thorough eye wash. Correct answer is A. Immediately attempt to remove the suspected foreign body using sterile forceps, then document the procedure and findings. Explanation. This scenario is professionally challenging because it involves a patient presenting with symptoms that could indicate a corneal abrasion or a foreign body, both of which require specific optometric technician skills and adherence to established protocols. The technician must accurately assess the situation, determine the appropriate course of action within their scope of practice, and ensure patient safety and comfort while maintaining regulatory compliance. The core challenge lies in distinguishing between conditions that can be managed by the technician and those requiring immediate physician intervention, all while documenting procedures accurately. The correct approach involves the technician performing a preliminary assessment, including visual acuity and a basic examination of the affected eye, to identify the presence of a foreign body or signs of corneal abrasion. If a foreign body is suspected and appears superficial, the technician, under direct supervision of the optometrist, may proceed with its removal using sterile instruments and appropriate techniques, followed by a post-procedure assessment and documentation. This aligns with the scope of practice for certified optometric technicians as defined by the relevant regulatory framework, which permits them to perform certain minor procedures under supervision. The emphasis on direct supervision, sterile technique, and thorough documentation is critical for patient safety and legal compliance. An incorrect approach would be for the technician to attempt removal of a deeply embedded foreign body, or to proceed with any invasive procedure without direct supervision. This violates the principle of working within one's defined scope of practice and could lead to further ocular damage, infection, or vision loss. Another incorrect approach would be to administer topical medications without a specific order from the supervising optometrist, as this constitutes practicing medicine without a license and bypasses established patient care protocols. Failing to document the procedure, findings, and any interventions taken is also a significant regulatory and ethical failure, hindering continuity of care and potentially exposing the practice to liability. Professional decision-making in such situations requires a systematic approach. First, assess the patient's chief complaint and visual acuity. Second, perform a visual inspection of the eye, noting any obvious abnormalities. Third, consult with the supervising optometrist regarding findings and suspected diagnosis. Fourth, if the procedure falls within the technician's scope of practice and under direct supervision, proceed with the intervention using sterile technique and appropriate instrumentation. Finally, meticulously document all findings, interventions, patient response, and follow-up instructions, ensuring all actions are in accordance with the Optometric Technician Certification Exam (OT) regulatory framework. Question 2. Process analysis reveals that during a routine refraction, a patient reports significant discomfort and a feeling of not seeing clearly with the current lens power, even after minor adjustments to the phoropter. The patient expresses a strong preference for a noticeably different lens power than what was previously prescribed. What is the most appropriate course of action for the optometric technician in this situation? Option A. Consult with the supervising optometrist to discuss the patient's subjective complaints and findings before proceeding with any significant prescription changes. Option B. Immediately adjust the lens power to match the patient's stated preference, assuming their subjective report is the most accurate indicator of their needs. Option C. Inform the patient that their subjective complaints are likely minor and proceed with the existing prescription. As the technician has already performed preliminary adjustments, Option D. Suggest a significant change in lens power based on the patient's verbal description of discomfort, without further objective or subjective verification or consultation. The correct answer is A. Consult with the supervising optometrist to discuss the patient's subjective complaints and findings before proceeding with any significant prescription changes. Explanation. This scenario is professionally challenging because it requires the optometric technician to balance the immediate need for patient comfort and clear vision with the long-term implications of prescribing incorrect refractive correction. The technician must recognize the limitations of their role and the potential for harm if they overstep their authority or make assumptions about the patient's needs without proper verification. The core of the challenge lies in understanding when to proceed independently and when to seek immediate supervision or refer to the optometrist. The correct approach involves recognizing that while the technician can perform preliminary refractions and assist in lens selection, the final determination of the prescription, especially when significant changes or patient discomfort are present, rests with the optometrist. This aligns with the regulatory framework for optometric technicians, which typically defines their scope of practice to include assisting the optometrist, performing specific diagnostic tests, and preparing for the optometrist's examination, but not independently making final prescription decisions. Ethical guidelines also mandate acting in the patient's best interest, which includes ensuring the accuracy and appropriateness of their vision correction, and this is best achieved through optometrist oversight for complex or unusual findings. An incorrect approach would be to assume the patient's subjective report of discomfort is solely due to minor adjustments and to proceed with significant changes to the prescription without consulting the optometrist. This fails to acknowledge the potential for underlying pathology or a more complex refractive error that requires the optometrist's diagnostic expertise. Ethically, this could lead to patient harm through an inaccurate prescription, causing eye strain, headaches, or even exacerbating existing conditions. It also violates the principle of professional responsibility by acting beyond the technician's authorized scope of practice. Another incorrect approach would be to dismiss the patient's subjective complaint entirely and proceed with the existing prescription without further investigation or consultation. This demonstrates a lack of patient-centered care and a failure to recognize that subjective feedback is a critical component of the refractive process. It ignores the potential for a genuine issue with the current correction or the patient's visual needs, which could lead to dissatisfaction and a compromised visual outcome. A third incorrect approach would be to immediately suggest a significant change in lens power based solely on the patient's verbal description of discomfort, without performing any objective or subjective verification steps or consulting the optometrist. This is premature and bypasses essential diagnostic procedures. It risks making an arbitrary change that may not address the root cause of the discomfort and could lead to an incorrect prescription. The professional decision-making process in such situations should involve a systematic approach. First, thoroughly document the patient's subjective complaint and any objective findings from preliminary tests. Second, assess whether the situation falls within the technician's defined scope of practice and independent decision-making authority. Third, if there is any doubt, ambiguity, or if the situation involves significant changes or patient discomfort, the technician must consult with the supervising optometrist. This ensures that the patient receives the highest standard of care and that all refractive decisions are made by the appropriately qualified professional. Question 3. Consider a scenario where an optometric technician is tasked with assisting an optometrist in a routine eye examination that includes screening for glaucoma. During the examination, the technician observes the patient's anterior chamber and notes that it appears relatively shallow. The optometrist has requested an assessment of the anterior chamber angle to aid in their diagnostic evaluation. Which of the following approaches best reflects the expected professional conduct and adherence to regulatory guidelines for an optometric technician in this situation? Option A. Inform the optometrist that the angle appears narrow and defer any further assessment to the doctor. Option B. Attempt to measure the anterior chamber depth using a ruler and record a precise millimeter measurement. Option C. Rely on a general visual impression of the anterior chamber's appearance and make a subjective note about its perceived depth. Option D. Perform the Van Herrick technique to qualitatively assess the anterior chamber angle and document the findings according to established grading scales. The correct answer is D. Perform the Van Herrick technique to qualitatively assess the anterior chamber angle and document the findings according to established grading scales. Explanation. This scenario presents a professional challenge due to the critical nature of glaucoma diagnosis and management, which directly impacts patient vision and quality of life. The optometric technician's role in accurately assessing anterior chamber depth is crucial for the optometrist's diagnostic process. Misinterpretation or inadequate assessment can lead to delayed or incorrect diagnosis, potentially causing irreversible vision loss. Therefore, meticulous adherence to established protocols and understanding of anatomical landmarks is paramount. The correct approach involves utilizing the Van Herrick technique to assess the anterior chamber angle. This method provides a standardized, qualitative estimation of the angle's width by observing the illuminated slit beam shadow. This technique is widely accepted and taught within optometric education and practice, forming a foundational skill for technicians assisting in glaucoma screening. Regulatory frameworks for optometric technicians typically emphasize the importance of accurate data collection and assisting the optometrist in diagnostic procedures. This approach directly supports the optometrist's ability to make informed decisions regarding glaucoma risk and management, aligning with the technician's scope of practice and ethical obligations to patient care. An incorrect approach would be to rely solely on visual estimation without a standardized technique. This is professionally unacceptable because subjective assessment is prone to significant variability and bias, leading to unreliable data. Regulatory guidelines for optometric technicians stress the importance of objective, reproducible measurements and observations. Failing to use a standardized method like Van Herrick means the technician is not providing the optometrist with consistent or dependable information, potentially compromising patient care and violating professional standards. Another incorrect approach would be to document a specific numerical value for the anterior chamber depth without using a calibrated instrument or a recognized grading scale. While the Van Herrick technique provides a qualitative assessment, attempting to assign a precise numerical depth without proper tools or training goes beyond the technician's scope and introduces potential inaccuracies. This deviates from established protocols and could mislead the optometrist, representing a failure to adhere to accepted practice standards and potentially violating regulations concerning the scope of practice for optometric technicians. A further incorrect approach would be to dismiss a narrow-appearing angle based on a cursory glance, without performing a systematic assessment. This demonstrates a lack of diligence and adherence to established screening protocols. Glaucoma risk is multifactorial, and a seemingly narrow angle requires formal evaluation to determine its clinical significance. Failing to perform the Van Herrick technique or a similar standardized assessment means a critical step in the glaucoma screening process has been omitted, which is a direct contravention of professional responsibilities and regulatory expectations for patient safety. The professional decision-making process for similar situations should involve prioritizing patient safety and accurate data collection. Technicians must be proficient in the standardized techniques taught and expected within their regulatory framework. When faced with a patient requiring anterior chamber assessment, the technician should recall and apply the appropriate method, e.g., Van Herrick. If unsure about any aspect of the procedure or interpretation, seeking clarification from the supervising optometrist is essential. This ensures that the information provided is reliable, supports accurate diagnosis, and upholds the ethical and regulatory standards of the profession. Question 4. System analysis indicates a new contact lens where it expresses confusion regarding the multi-step cleaning and disinfection process for their rigid gas permeable RGP lenses, specifically mentioning difficulty remembering the order of solutions and the required soaking time. The optometric technician is tasked with reinforcing these instructions. Which of the following approaches best ensures the patient's understanding and promotes safe contact lens wear? Option A. Advise the patient to ask their optometrist for clarification during their next scheduled appointment, as the technician is not authorized to provide detailed instruction. Option B. Suggest the patient watch a general online video tutorial about RGP lens care, as these often cover the basic principles. Option C. Reiterate the instructions verbally, emphasizing the importance of following the exact sequence and duration as outlined in the manufacturer's leaflet. Option D. Provide a simplified, step-by-step written guide with visual aids, and ask the patient to verbally explain the process back to the technician. The correct answer is D. Provide a simplified, step-by-step written guide with visual aids and ask the patient to verbally explain the process back to the technician. Explanation. This scenario presents a common implementation challenge in optometric practice, ensuring patient compliance with contact lens care instructions, which directly impacts ocular health and the success of contact lens wear. The challenge lies in balancing the need for accurate instruction with the patient's ability to understand and follow complex regimens, especially when dealing with potential complications. Careful judgment is required to assess the patient's comprehension and provide appropriate, individualized guidance. The correct approach involves a multifaceted strategy that prioritizes patient education and empowers the patient to manage their contact lens care effectively. This includes demonstrating proper lens handling, cleaning, and disinfection techniques, explaining the rationale behind each step, and thoroughly reviewing potential complications and their warning signs. Crucially, it involves confirming the patient's understanding through teach-back methods and providing clear, accessible written materials. This aligns with the ethical obligation to provide competent care and the regulatory framework that mandates patient education to prevent harm and ensure safe practice. The Optometric Technician Certification Exam, OT, emphasizes the technician's role in patient education and adherence to prescribed care, which is paramount for preventing contact lens-related infections and complications. An incorrect approach would be to simply hand the patient a set of instructions without verifying comprehension. This fails to meet the ethical standard of care, as it assumes understanding without confirmation and neglects the technician's responsibility to ensure the patient can safely manage their lenses. This approach also violates the spirit of regulatory guidelines that aim to protect patient health by ensuring they are adequately informed and capable of following prescribed care. Another incorrect approach is to provide overly technical or complex explanations that the patient may not fully grasp. While factually accurate, this can lead to confusion and noncompliance, ultimately jeopardizing ocular health. The regulatory framework expects technicians to communicate information in a manner that is understandable to the patient, adapting their communication style as needed. Finally, an incorrect approach would be to dismiss the patient's concerns or questions about lens care, implying that their difficulties are a personal failing rather than an opportunity for further education and support. This demonstrates a lack of empathy and professionalism, and it fails to address potential barriers to compliance that could lead to adverse outcomes. The regulatory framework emphasizes a patient-centered approach, where the technician actively engages with the patient to address their needs and concerns. The professional decision-making process for similar situations should involve a thorough assessment of the patient's learning style and comprehension level. This includes active listening, asking open-ended questions, and utilizing teach-back methods to confirm understanding. The technician should be prepared to adapt their communication and provide additional resources or demonstrations as needed, always prioritizing the patient's safety and well-being in accordance with ethical and regulatory standards. Question 5. Operational review demonstrates that an optometric technician is performing a dilated fundus examination and observes subtle changes in the macula, including some small, yellowish deposits and a slight blurring of the foveal reflex. The technician also notes that the retinal vasculature appears somewhat tortuous in the superior temporal quadrant. Considering the potential for serious retinal pathology, which of the following actions best reflects the technician's professional responsibility and adherence to regulatory guidelines for patient care? Option A. Focus only on the presence of the yellowish deposits and ignore the blurring of the foveal reflex and the tortuous vasculature, as the deposits are the most obvious finding. Option B. Record that the macula appears slightly abnormal and the vasculature is tortuous, without further specific detail, and proceed to the next patient. Option C. Document the presence of small, yellowish deposits and tortuous vasculature, and specifically note the blurring of the foveal reflex, then report these findings to the supervising optometrist for further evaluation. Option D. Assume the yellowish deposits are benign age-related changes and the tortuous vasculature is a normal variation, and therefore do not report these findings to the optometrist. Correct answer is C. Document the presence of small, yellowish deposits and tortuous vasculature, and specifically note the blurring of the foveal reflex, then report these findings to the supervising optometrist for further evaluation. Explanation. This scenario presents a professional challenge due to the critical nature of retinal health and the potential for rapid vision loss associated with certain retinal conditions. An optometric technician's role in identifying and documenting subtle changes is paramount, requiring a thorough understanding of retinal anatomy and common pathologies. The technician must exercise careful judgment in distinguishing between normal variations and signs of disease, and in accurately reporting findings to the supervising optometrist. The correct approach involves meticulously documenting all observed retinal findings, including the appearance of the optic nerve head, macula, and peripheral retina, and noting any abnormalities in the retinal vasculature. This includes specific descriptions of the color, clarity, and integrity of the retinal pigment epithelium, RPE, and the presence or absence of drusen, exudates, hemorrhages, or neovascularization. This detailed and accurate documentation is essential for the optometrist to make an informed diagnosis and treatment plan. It directly aligns with the ethical obligation to provide competent patient care and the regulatory requirement for accurate record-keeping, ensuring that patient charts reflect the complete clinical picture. An incorrect approach of only noting gross abnormalities fails to capture the subtle early signs of conditions like diabetic retinopathy or age-related macular degeneration, AMD. This omission can lead to delayed diagnosis and treatment, potentially resulting in irreversible vision loss. Ethically, this constitutes a failure to provide the standard of care. Another incorrect approach of assuming a finding is benign without proper documentation and reporting to the optometrist is also professionally unacceptable. This bypasses the optometrist's expertise and can lead to misdiagnosis. It violates the principle of professional collaboration and the technician's responsibility to escalate concerns. A further incorrect approach of relying solely on automated retinal imaging analysis without a thorough manual review of the images and correlation with clinical findings can miss important contextual information or artifacts. While technology is a valuable tool, it does not replace the need for skilled clinical observation and interpretation. This can lead to both false positives and false negatives, impacting patient care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly examine the patient's retina, paying close attention to all anatomical structures and vasculature. Second, compare observations to known normal variations in common pathological presentations. Third, meticulously document all findings, both normal and abnormal, using precise terminology. Fourth, if any findings are concerning or unclear, escalate them to the supervising optometrist for further evaluation and diagnosis. This process ensures comprehensive patient care and adherence to professional and regulatory standards. Question 6. Strategic planning requires an optometric technician to effectively communicate a patient's diagnosed visual pathway anomaly. Considering the patient's potential anxiety and limited medical knowledge, which of the following communication strategies best supports patient understanding and adherence to care? Option A. Briefly stating that there is an issue with their eye nerve and that it will likely resolve on its own without further explanation. Option B. Providing a detailed step-by-step explanation of the neuroanatomy and physiology of the entire visual pathway, including specific neuronal layers and synaptic connections. Option C. Utilizing analogies and visual aids to explain how light travels from the eye through the optic nerve, chiasm, tracts, LGN, and to the visual cortex, focusing on the functional impact of the anomaly on their vision. Option D. Discussing the patient's specific visual pathway findings with other patients in the waiting room to normalize the experience. The correct answer is C. Utilizing analogies and visual aids to explain how light travels from the eye through the optic nerve, chiasm, tracts, LGN, and to the visual cortex, focusing on the functional impact of the anomaly on their vision. Explanation. This scenario is professionally challenging because it requires an optometric technician to interpret and communicate complex visual pathway information to a patient who may have limited understanding of ocular anatomy and physiology. The technician must balance the need for accurate information with the patient's comprehension and emotional state, all while adhering to professional standards of care and patient privacy. Careful judgment is required to ensure the patient receives information in a way that is both informative and reassuring, avoiding unnecessary anxiety. The correct approach involves explaining the visual pathway in a simplified, yet accurate, manner, using analogies and visual aids where appropriate, and focusing on how the identified issue impacts the patient's vision. This approach prioritizes patient education and empowerment, enabling them to better understand their condition and treatment plan. It aligns with the ethical obligation to provide clear and understandable information to patients, fostering informed consent and shared decision-making. While specific regulations for optometric technicians in the U.S. may vary by state, the overarching principles of patient communication and education are universally recognized in healthcare. An incorrect approach would be to overwhelm the patient with highly technical jargon, such as detailing the precise neuronal firing patterns within the lateral, geniculate nucleus, or the intricate laminar organization of the visual cortex. This fails to meet the standard of clear communication and can lead to patient confusion and distress, potentially hindering their engagement with their care. Another incorrect approach would be to dismiss the patient's concerns or provide overly simplistic, inaccurate explanations that downplay the significance of their visual pathway issue. This breaches the ethical duty of care and can erode patient trust. Finally, discussing the patient's specific visual pathway findings with other patients or unauthorized personnel would be a severe violation of patient privacy regulations, such as HIPAA in the United States, and a breach of professional ethics. Professionals should employ a decision-making framework that begins with assessing the patient's current level of understanding and their emotional state. This is followed by tailoring the explanation to their needs, using clear, concise language and appropriate aids. The professional should actively solicit questions and confirm understanding, ensuring the patient feels heard and informed. This patient-centered communication strategy is fundamental to ethical and effective optometric care. Question 7. Cost-benefit analysis shows that a patient presenting with mild, intermittent eye redness and discomfort, initially diagnosed by a supervising optometrist as likely benign conjunctivitis, warrants further investigation if the optometric technician observes subtle signs of scleral injection, and the patient reports persistent, deep-seated aching. Given the potential for serious underlying conditions like episcleritis or scleritis, what is the most appropriate course of action for the optometric technician to ensure optimal patient care within the regulatory framework of the Optometric Technician Certification Exam OT? Option A. Directly inform the supervising optometrist that their diagnosis is incorrect and insist on further testing for inflammatory conditions. Option B. Reassure the patient that the supervising optometrist's diagnosis is likely correct and advise them to return if symptoms significantly worsen. Option C. Document the patient's subjective complaints and the technician's objective observations, then respectfully request a second opinion from another optometrist within the practice, or refer the patient to an ophthalmologist if practice policy dictates and the condition appears severe. Option D. Advise the patient to seek care from a different eye care professional without informing the supervising optometrist or practice. Correct answer is C. Document the patient's subjective complaints and the technician's objective observations, then respectfully request a second opinion from another optometrist within the practice, or refer the patient to an ophthalmologist if practice policy dictates and the condition appears severe. Explanation. This scenario presents a professional challenge because the optometric technician is faced with a situation where a patient's subjective report of discomfort, potentially indicative of episcleritis or scleritis, conflicts with the objective findings of a less experienced supervising optometrist. The technician must balance their duty to the patient's well-being with professional respect for the supervising clinician's judgment, all while adhering to the Optometric Technician Certification Exam OT regulatory framework, which emphasizes patient care and scope of practice. The ethical dilemma lies in knowing when to escalate concerns beyond the immediate supervisor. The correct approach involves the optometric technician respectfully documenting their findings and concerns, and then seeking a second opinion from a different, more experienced optometrist within the practice or clinic, or by referring the patient to an ophthalmologist if the practice structure allows and the condition warrants. This approach is ethically sound and aligns with the OT regulatory framework by prioritizing patient safety and ensuring accurate diagnosis and treatment. It acknowledges the technician's role in patient care, which includes recognizing and reporting potential issues, and provides a mechanism for addressing diagnostic discrepancies without undermining the supervising optometrist directly or prematurely. This ensures the patient receives the most appropriate care, especially when dealing with potentially serious inflammatory conditions of the sclera. An incorrect approach would be to dismiss the patient's symptoms based solely on the supervising optometrist's initial assessment, even if the technician has a strong suspicion of a more serious condition like scleritis. This fails to uphold the duty of care to the patient and could lead to delayed or inadequate treatment, potentially causing harm. Another incorrect approach would be to directly confront or contradict the supervising optometrist in front of the patient, which is unprofessional and erodes the doctor-technician working relationship. Furthermore, a technician should not independently diagnose or prescribe treatment for episcleritis or scleritis, as this falls outside their defined scope of practice under the OT certification. Professionals should employ a decision-making process that involves 1. Thorough patient assessment and documentation. 2. Recognizing potential red flags or discrepancies. 3. Understanding their scope of practice and limitations. 4. Communicating concerns professionally and respectfully to the appropriate parties. And 5. Escalating issues when patient safety or well-being is at risk, following established practice protocols. Question 8. Compliance review shows an optometric technician observing a patient presenting with significant eye pain, photophobia, and a visibly hazy cornea with a possible localized infiltrate. The technician has also noted the patient reports a recent history of contact lens wear. Which of the following represents the most appropriate immediate action for the optometric technician? Option A. Document all observed signs and symptoms, including the patient's history and the appearance of the cornea, and immediately alert the supervising optometrist to the findings. Option B. Reassure the patient that the hazy cornea is likely due to dry eyes and will resolve with rest. Option C. Attempt to stain the cornea with fluorescein to better visualize any epithelial defect and then document the findings. Option D. Advise the patient to discontinue contact lens wear and use over-the-counter lubricating eye drops until their next scheduled appointment. The correct answer is A. Document all observed signs and symptoms, including the patient's history and the appearance of the cornea, and immediately alert the supervising optometrist to the findings. Explanation. This scenario is professionally challenging because it requires the optometric technician to accurately identify and differentiate between various corneal conditions based on visual observation and patient history, while adhering strictly to the scope of practice defined by the Optometric Technician Certification Exam (OT) regulatory framework. Misidentification can lead to inappropriate patient management, delayed or incorrect treatment, and potential harm to the patient's vision. The technician must exercise sound judgment in recognizing when a condition requires immediate referral to the supervising optometrist. The correct approach involves the technician meticulously documenting all observed signs and symptoms related to the cornea, including any changes in clarity, shape, or surface integrity, and correlating these findings with the patient's reported symptoms. This systematic approach ensures that all relevant clinical information is gathered for the optometrist's diagnosis. Specifically, the technician should be able to recognize signs indicative of corneal edema, e.g., hazy cornea, stromal thickening, abrasions, e.g., epithelial defect, staining with fluorescein, or potential keratitis/ulcers, e.g., stromal infiltrate, significant pain, photophobia. The regulatory framework for the OT exam emphasizes the technician's role in assisting the optometrist by performing specific diagnostic tests and gathering objective data. Therefore, accurately observing and reporting these findings, and recognizing the urgency of certain presentations like suspected ulcers or significant edema, aligns with the technician's defined responsibilities and the ethical obligation to patient care. An incorrect approach would be to attempt to diagnose the specific corneal disease. The OT's scope of practice does not include making medical diagnoses. Another incorrect approach would be to dismiss the patient's symptoms or observed signs as minor without thorough documentation and reporting to the optometrist, which could violate the duty of care and regulatory guidelines regarding patient assessment. Furthermore, providing any form of treatment or advice beyond basic comfort measures, e.g., advising on artificial tears for mild dryness, would exceed the technician's scope and be a regulatory failure. Professionals should employ a decision-making process that prioritizes patient safety and adheres to the established scope of practice. This involves a clear understanding of what observations and data collection fall within their purview and when to escalate concerns to the supervising optometrist. A structured approach, starting with patient history, followed by objective observations and measurements, and culminating in clear, concise reporting to the optometrist, is essential for effective and compliant patient care. Question 9. The control framework reveals that an optometric technician is evaluating a patient's current spectacles and observes that straight lines appear to curve outwards at the edges of the lens when viewed by the patient. The technician also notes a slight rainbow effect around high-contrast objects. Considering the principles of lens optics and common aberrations, which approach best addresses this situation according to the Optometric Technician Certification Exam (OT) standards? Option A. Conclude that the lens power is incorrect and adjust it based on the observed distortions. Option B. Identify the distortions as likely representing chromatic aberration and possibly barrel distortion, and proceed with lens verification and consultation with the optometrist. Option C. Assume the patient is experiencing general visual discomfort and recommend a new prescription without further lens analysis. Option D. Dismiss the rainbow effect as a minor issue and focus only on the perceived curvature of lines. The correct answer is A. Conclude that the lens power is incorrect and adjust it based on the observed distortions. Explanation. This scenario presents a professional challenge because it requires an optometric technician to accurately identify and differentiate between lens aberrations, which directly impact patient vision and comfort. Misidentification can lead to incorrect lens prescriptions or adjustments, potentially causing patient dissatisfaction, visual impairment, and a breach of professional standards. The technician must apply their knowledge of lens types and their inherent optical properties to discern subtle visual distortions. The correct approach involves a systematic evaluation of the visual distortions observed through the lens, correlating these distortions with known types of lens aberrations. This requires a thorough understanding of how convex and concave lenses, as well as lens power and focal length, contribute to phenomena like chromatic aberration, spherical aberration, and distortion. By accurately identifying the aberration, the technician can then determine the appropriate course of action, whether it be recommending a different lens type, adjusting the current lens, or consulting with the optometrist. This aligns with the ethical obligation to provide accurate and effective vision care, ensuring patient safety and optimal visual outcomes, as mandated by the Optometric Technician Certification Exam (OT) framework, which emphasizes precision in lens evaluation and application. An incorrect approach of assuming all distortions are due to simple power errors fails to acknowledge the complexity of lens optics and the specific nature of aberrations. This oversight can lead to incorrect adjustments or prescriptions, violating the principle of providing accurate vision correction and potentially causing harm to the patient's vision. Another incorrect approach of dismissing minor distortions as insignificant ignores the cumulative effect of aberrations on visual acuity and comfort, and it contravenes the professional duty to address all aspects of visual performance. Furthermore, an approach that relies solely on patient subjective complaints without objective lens analysis is insufficient, as patients may not be able to articulate the precise nature of their visual disturbance. An objective lens assessment is a core competency for an optometric technician. Professionals should approach such situations by first performing a thorough lensometry to objectively measure the lens parameters. Following this, they should systematically observe and analyze any visual distortions experienced by the patient when looking through the lens. This objective and subjective analysis should then be correlated with their knowledge of lens types, power, focal length, and common aberrations. If an aberration is identified, the technician should consult relevant guidelines or the optometrist for the most appropriate corrective action, ensuring patient care is prioritized and all regulatory requirements for accurate lens assessment are met. Question 10. The assessment process reveals a patient reporting intermittent double vision that becomes more pronounced when they are tired. During the examination, the optometric technician observes a slight outward turning of one eye when the patient is fatigued. Which of the following actions best adheres to the regulatory framework for an optometric technician certification exam (OT) in the United States? Option A. Record the findings but consider the diplopia a minor symptom that can be managed with rest and advise the patient to return if it worsens significantly. Option B. Document the patient's reported symptoms of intermittent diplopia and the observed eye deviation, and immediately report these findings to the supervising optometrist for further evaluation and diagnosis. Option C. Inform the patient that they likely have a common form of strabismus and recommend specific eye exercises to correct it. Option D. Attempt to perform advanced diagnostic tests for strabismus, such as cover-uncover tests with prism, to determine the exact angle of deviation before consulting the optometrist. Correct answer is B. Document the patient's reported symptoms of intermittent diplopia and the observed eye deviation, and immediately report these findings to the supervising optometrist for further evaluation and diagnosis. Explanation. The assessment process reveals a patient presenting with symptoms suggestive of strabismus, specifically intermittent diplopia, that worsens with fatigue. This scenario is professionally challenging because an optometric technician, while skilled in patient care and preliminary testing, operates under the direct supervision of an optometrist. The technician's role is to gather objective data and assist the optometrist, not to independently diagnose or manage conditions. Misinterpreting findings or overstepping the scope of practice can lead to delayed or incorrect treatment, patient harm, and regulatory violations. Careful judgment is required to ensure all actions are within the defined scope of practice, and that the optometrist is promptly informed of all relevant findings. The correct approach involves accurately documenting the patient's reported symptoms of intermittent diplopia and any observed eye deviations during the examination, and then clearly communicating these findings to the supervising optometrist. This aligns with the regulatory framework for optometric technicians, which emphasizes assisting the optometrist in patient care and data collection. The technician's responsibility is to be a thorough and accurate observer and recorder, facilitating the optometrist's diagnostic and treatment decisions. This approach upholds ethical principles of patient safety and professional responsibility by ensuring the patient receives care from the licensed practitioner qualified to diagnose and manage their condition. An incorrect approach would be to attempt to diagnose the specific type of strabismus or to suggest management strategies. This oversteps the technician's scope of practice, which is to collect data and assist, not to diagnose or prescribe. Such an action would be a direct violation of the regulatory framework governing optometric technicians, potentially leading to disciplinary action. Another incorrect approach would be to dismiss the patient's reported diplopia as insignificant or a minor issue without thorough documentation and reporting to the optometrist. This failure to adequately document and report subjective patient complaints could lead to a delay in diagnosis and treatment, potentially causing harm to the patient and violating ethical obligations to provide diligent care. Professionals should employ a decision-making framework that prioritizes patient safety and adherence to scope of practice. This involves 1. Thoroughly understanding the patient's reported symptoms and performing all assigned objective tests accurately. 2. Documenting all findings meticulously. 3. Recognizing the limits of their professional scope and the necessity of optometrist involvement for diagnosis and management. 4. Communicating all relevant information promptly and clearly to the supervising optometrist. 5. Seeking clarification from the optometrist if unsure about any aspect of patient care or findings. Question 11. The risk matrix shows a patient presenting with complaints of difficulty reading small print and experiencing eye strain when performing close-up tasks, particularly in the evening. The patient also reports clear vision for distant objects. Based on these subjective reports, which of the following best describes the likely refractive error the optometric technician should document for the supervising optometrist's review, considering the typical presentation of common refractive conditions? Option A. Document findings consistent with astigmatism, describing distorted vision at all distances. Option B. Document findings consistent with hyperopia, noting potential difficulty with near vision and eye strain. Option C. Document findings consistent with presbyopia, noting the age-related difficulty with near vision and clear distance vision. Option D. Document findings consistent with myopia, indicating difficulty with distant vision. Correct answer is C. Document findings consistent with presbyopia, noting the age-related difficulty with near vision and clear distance vision. Explanation. This scenario is professionally challenging because it requires the optometric technician to accurately identify and document refractive errors based on patient-reported symptoms and objective findings, while adhering strictly to the scope of practice defined by the Optometric Technician Certification Exam (OT) regulatory framework. Misinterpreting or misdocumenting these findings can lead to incorrect prescriptions, patient dissatisfaction, and potential harm. Careful judgment is required to differentiate between common refractive errors and to ensure the information gathered is precise and actionable for the supervising optometrist. The correct approach involves meticulously recording the patient's subjective complaints related to vision clarity at different distances and noting any objective measurements or observations that suggest a refractive error. This aligns with the OT's role in assisting the optometrist by gathering and documenting essential patient data. Specifically, the technician must be able to recognize descriptions indicative of myopia, difficulty seeing distant objects, hyperopia, difficulty seeing near objects, often with eye strain, astigmatism, blurry or distorted vision at all distances due to an irregularly shaped cornea or lens, and presbyopia, age-related difficulty with near vision. Emmetropia, the absence of refractive error, would be indicated by clear vision at all distances without complaint. The regulatory framework for the OT exam emphasizes accurate data collection and communication to support the optometrist's diagnostic and treatment decisions. An incorrect approach would be to make assumptions about the refractive error based on a single symptom, without gathering further information or objective data. For example, assuming all near vision complaints are presbyopia without considering other possibilities like uncorrected hyperopia or accommodative issues would be a failure to conduct a thorough assessment within the technician's purview. Another incorrect approach would be to document findings in a vague or subjective manner, such as patient sees blurry, without specifying the distance at which the blur occurs or the nature of the distortion. This lacks the specificity required for accurate clinical decision-making and violates the principle of precise documentation mandated by professional standards. Furthermore, attempting to diagnose or explain the cause of the refractive error to the patient, rather than simply documenting observations and symptoms for the optometrist, exceeds the technician's scope of practice and could lead to misinformation. The professional reasoning process for similar situations involves a systematic approach. First, actively listen to and record the patient's chief complaint and any associated symptoms. Second, perform objective tests and measurements as per established protocols, noting any deviations from normal. Third, correlate subjective complaints with objective findings to identify potential refractive errors. Fourth, document all findings clearly, concisely, and accurately using appropriate terminology. Finally, present the gathered information to the supervising optometrist for their interpretation and diagnosis. This structured process ensures all relevant information is collected, the technician's scope of practice is respected, and the patient receives appropriate care. Question 12. The efficiency study reveals that an optometric technician is interacting with a patient who reports experiencing new, numerous, and significantly larger floaters, accompanied by occasional flashes of light in their peripheral vision. The patient expresses concern about these visual disturbances. What is the most appropriate action for the optometric technician to take in this situation? Strictly adhering to the regulatory framework for optometric technicians. Option A. Reassure the patient that floaters and flashes are common and usually benign, advising them to monitor the symptoms and report any significant changes to the office at a later appointment. Option B. Document the patient's reported symptoms of new, numerous, and larger floaters, along with the flashes of light, and immediately inform the supervising optometrist of these findings for further evaluation. Option C. Attempt to explain to the patient that the symptoms are likely due to age-related changes in the vitreous humor, and that no immediate action is necessary. Option D. Advise the patient to research vitreous detachment and retinal detachment online to better understand their condition before their next scheduled appointment. The correct answer is B. Document the patient's reported symptoms of new, numerous, and larger floaters, along with the flashes of light, and immediately inform the supervising optometrist of these findings for further evaluation. Explanation. This scenario is professionally challenging because it requires the optometric technician to balance patient education with the limitations of their scope of practice, while also ensuring accurate and timely communication with the supervising optometrist. The technician must understand the vitreous humor structure and function to explain common phenomena like floaters and more serious conditions like vitreous hemorrhage and retinal detachment, but must do so within the established regulatory framework for optometric technicians. The correct approach involves the optometric technician accurately documenting the patient's subjective complaints regarding visual disturbances, specifically mentioning floaters and any perceived flashes of light or sudden onset of new floaters, and then promptly relaying this information to the supervising optometrist. This approach is correct because it adheres to the principle of working within the defined scope of practice for an optometric technician, which typically includes patient history taking and symptom documentation, but not diagnosis or treatment. The regulatory framework for optometric technicians emphasizes assisting the optometrist and ensuring clear, accurate communication of patient findings. By documenting and reporting, the technician fulfills their role in the patient care process, allowing the optometrist to perform the necessary diagnostic examinations and make clinical judgments. This also ensures patient safety by not providing information that could be misinterpreted or lead to delayed professional medical attention. An incorrect approach would be for the optometric technician to attempt to diagnose the cause of the floaters or flashes, or to reassure the patient that the symptoms are benign without a definitive examination by the optometrist. This is a regulatory and ethical failure because it exceeds the technician's scope of practice. Optometric technicians are not licensed to diagnose ocular conditions. Providing a diagnosis or reassurance without proper examination could lead to a delay in the diagnosis and treatment of serious conditions like retinal detachment, potentially causing irreversible vision loss. This also violates the ethical obligation to act in the patient's best interest and to maintain professional boundaries. Another incorrect approach would be for the optometric technician to ignore the patient's complaints of floaters and flashes, or to dismiss them as unimportant. This is a failure to uphold professional responsibility and could have serious consequences for the patient. Ignoring symptoms, especially those that could indicate a vitreous hemorrhage or retinal detachment, is a breach of the duty of care. It also fails to recognize the importance of patient-reported symptoms in the diagnostic process and bypasses the established protocol for escalating patient concerns to the supervising optometrist. The professional reasoning process for similar situations should involve a clear understanding of one's scope of practice as defined by the relevant licensing board and regulatory statutes. When presented with patient complaints, the technician should first focus on accurate and thorough documentation of the subjective and objective findings within their purview. The next critical step is to identify any symptoms or signs that warrant immediate attention from the supervising optometrist, particularly those that could indicate a sight-threatening condition. Prompt and clear communication with the optometrist is paramount. If unsure about the significance of a symptom or the appropriate course of action, the technician should err on the side of caution and consult with the optometrist. Patient education should be limited to general information about ocular anatomy and common conditions, always deferring diagnostic and prognostic statements to the licensed practitioner. Question 13. Market research demonstrates a growing demand for spectacle lenses that offer enhanced visual performance and durability for active lifestyles. A patient presents with a prescription that includes a moderate amount of prism correction for binocular vision issues, along with a significant spherical and cylindrical refractive error. The patient works outdoors frequently and engages in various sports. Considering these factors, which of the following approaches best aligns with the optometric technician's role in recommending spectacle lens solutions? Option A. Recommend progressive lenses with a specialized sport-specific design, incorporating the prism correction, and discuss the benefits of photochromic and impact-resistant coatings. Option B. Recommend high-index single-vision lenses with a basic anti-scratch coating, focusing on the refractive correction and ensuring the prism is present. Option C. Recommend standard single-vision lenses made from polycarbonate material with an anti-reflective coating, ensuring the prism is incorporated accurately into the lens design. Option D. Recommend basic bifocal lenses with the prism correction, prioritizing cost-effectiveness for the patient's outdoor activities. The correct answer is C. Recommend standard single-vision lenses made from polycarbonate material with an anti-reflective coating, ensuring the prism is incorporated accurately into the lens design. Explanation. This scenario presents a professional challenge because an optometric technician is tasked with recommending spectacle lens solutions based on a patient's prescription and lifestyle, requiring a nuanced understanding of lens materials, coatings, and designs beyond just fulfilling the refractive error. The challenge lies in balancing patient needs, prescription complexity, and the available technological solutions, while adhering to professional standards and ethical practice. Careful judgment is required to avoid overprescribing or underprescribing lens features that could impact visual performance, comfort, or durability. The correct approach involves a thorough assessment of the patient's visual demands, occupational needs, and personal preferences, followed by an informed recommendation of lens materials, coatings, and designs that best address these factors and the prescribed refractive correction, including any prism. This approach is justified by the ethical obligation to provide patient-centered care, ensuring the best possible visual outcome and satisfaction. It aligns with the professional responsibility to stay current with lens technology and its applications, thereby maximizing the benefits of the prescribed eyewear. An incorrect approach would be to solely focus on the most basic or least expensive lens options, disregarding the patient's lifestyle and potential benefits of advanced lens features. This fails to meet the ethical standard of providing comprehensive care and could lead to patient dissatisfaction if the chosen lenses do not adequately meet their visual needs. Another incorrect approach would be to recommend the most technologically advanced or expensive options without a clear justification based on the patient's specific needs, potentially leading to unnecessary costs for the patient and a perception of upselling rather than genuine care. Recommending a lens design that does not adequately incorporate the prescribed prism correction, or suggesting a material unsuitable for the patient's activities, would also be professionally unacceptable, as it directly compromises the visual efficacy of the prescribed correction. Professionals should employ a decision-making framework that prioritizes patient education and shared decision-making. This involves actively listening to the patient's concerns and lifestyle, explaining the rationale behind different lens options in clear, understandable terms, and collaboratively selecting the most appropriate solution. This process ensures that the patient is an informed participant in their own care, leading to greater trust and satisfaction. Question 14. Benchmark analysis indicates that an optometric technician is explaining the visual experience of a patient who is experiencing glare from a new pair of glasses. The patient asks, "Why does the light seem to bend and spread out like that when I look at bright lights through these lenses?" The technician knows this is related to diffraction and interference patterns caused by the lens curvature and coatings, but the patient has no optical background. Which approach best addresses the patient's question while adhering to professional responsibilities? Option A. Tell the patient that it's a complex optical phenomenon involving wave interference and diffraction that they likely wouldn't understand. Option B. Explain that the light is scattering due to the way the lens surface interacts with light waves, causing it to spread out and appear less sharp, which is a common optical phenomenon. Option C. State that the glare is a manufacturing defect in the lens and advise them to return the glasses immediately. Option D. Describe the detailed mathematical principles of Huygens principle and Fourier optics as they apply to lens aberrations. The correct answer is B. Explain that the light is scattering due to the way the lens surface interacts with light waves, causing it to spread out and appear less sharp, which is a common optical phenomenon. Explanation. This scenario presents a professional challenge because it requires the optometric technician to balance patient care with the ethical obligation to provide accurate and complete information, even when it might be perceived as inconvenient or overly technical. The technician must understand the principles of light to effectively explain optical phenomena to patients, but also recognize the boundaries of their professional scope and the importance of clear, understandable communication. Careful judgment is required to determine how much detail is appropriate for a patient's understanding without causing confusion or anxiety. The correct approach involves explaining the phenomenon of light scattering in a simplified, yet accurate manner, relating it directly to the patient's visual experience. This approach prioritizes patient education and empowers the patient to understand their condition and treatment. It aligns with the ethical principle of beneficence, ensuring the patient receives the information necessary for informed decision-making, and the principle of autonomy, respecting the patient's right to understand their health. While not explicitly stated in a single regulation for optometric technicians, this approach is foundational to professional conduct and patient-centered care, which are implicitly expected within the scope of practice and ethical guidelines governing healthcare professionals. The technician is acting within their scope by explaining optical principles as they relate to vision. An incorrect approach would be to dismiss the patient's observation as insignificant or to provide a highly technical, jargon-filled explanation that the patient cannot comprehend. Dismissing the observation fails to acknowledge the patient's subjective experience and can erode trust, violating the principle of non-maleficence by potentially causing distress or a sense of being unheard. Providing an overly technical explanation, without simplification, fails to meet the patient's need for understanding, hindering informed consent and potentially violating the spirit of clear communication expected of healthcare providers. Another incorrect approach would be to speculate on causes beyond the technician's expertise or to offer a diagnosis. This would exceed the technician's scope of practice, potentially leading to misdiagnosis and harm, a clear violation of professional boundaries and the principle of non-maleficence. The professional decision-making process for similar situations should involve first actively listening to and validating the patient's concerns. Then, the technician should assess the patient's level of understanding and tailor their explanation accordingly, using analogies and simple terms. They should focus on how the optical principle directly impacts the patient's vision. If the patient's concern suggests a potential underlying pathology or requires a diagnosis, the technician must recognize their limitations and refer the patient to the optometrist. Question 15. Compliance review shows that during a routine automated parametry Humphrey test for a patient experiencing new-onset headaches, the visual field printout revealed a dense, superior altitudinal hemianopsia. The optometric technician is aware that this type of visual field defect can be indicative of neurological conditions. What is the best practice approach for the technician in this situation? Option A. Inform the patient that the test shows a significant issue and advise them to schedule an urgent appointment with a neurologist. Option B. Reassure the patient that visual field defects are common and can be related to eye strain, suggesting they try artificial tears. Option C. Perform a confrontation visual field test to confirm the automated parametry results before reporting them to the optometrist. Option D. Document the visual field defect accurately on the patient's chart and immediately report the findings and the specific pattern of loss to the supervising optometrist for further evaluation and management. The correct answer is A. Inform the patient that the test shows a significant issue and advise them to schedule an urgent appointment with a neurologist. Explanation. This scenario presents a professional challenge because it requires the optometric technician to interpret and act upon visual field test results that indicate a potential neurological issue, which extends beyond routine refractive error assessment. Technician must recognize the limitations of their scope of practice while ensuring patient safety and appropriate referral. Careful judgment is required to balance the need for timely diagnosis with the ethical and regulatory boundaries of their role. The correct approach involves accurately documenting the findings from the automated parametry, noting the specific patterns of visual field loss, and immediately communicating these findings to the supervising optometrist. This aligns with best practices for patient care and diagnostic accuracy. Regulatory frameworks for optometric technicians emphasize the importance of accurate data collection and reporting to the licensed practitioner, who is ultimately responsible for diagnosis and treatment. This approach ensures that the patient receives prompt and appropriate medical evaluation for a potentially serious condition. An incorrect approach would be to attempt to diagnose the cause of the visual field defect or to reassure the patient that it is a minor issue without consulting the optometrist. This oversteps the technician's scope of practice, which is to perform tests and gather data, not to diagnose. It also poses a significant risk to the patient by delaying or misdirecting their care. Another incorrect approach would be to simply record the data without flagging it as potentially significant or communicating it promptly to the optometrist. This failure to recognize and report critical findings could lead to delayed diagnosis and treatment, violating ethical obligations to patient welfare and potentially contravening guidelines on reporting significant clinical observations. Professionals should employ a decision-making framework that prioritizes patient safety and adheres strictly to their defined scope of practice. This involves 1. Performing the diagnostic test accurately and efficiently. 2. Recognizing and interpreting deviations from normal findings within the context of their training. 3. Understanding when a finding requires escalation to the supervising licensed practitioner. 4. Communicating critical information clearly and promptly to the appropriate individual. 5. Documenting all actions and communications thoroughly. Question 16. The evaluation methodology shows an optometric technician has completed a patient examination and is preparing to document findings. The supervising optometrist instructs the technician to record a visual acuity measurement that the technician knows, based on their direct observation, and the equipment used is inaccurate. Option A. Make a note in the patient's chart that the visual acuity was recorded as instructed, but that it is believed to be inaccurate. Option B. Politely inform the supervising optometrist of the discrepancy and request to re-verify the visual acuity measurement, explaining the concern for patient care and accurate record keeping. Option C. Record the visual acuity as instructed by the supervising optometrist to avoid conflict and maintain professional harmony. Option D. Immediately leave the examination room and report the optometrist's instruction to the State Board of Optometry without speaking to the optometrist first. Correct answer is B. Politely inform the supervising optometrist of the discrepancy and request to re-verify the visual acuity measurement, explaining the concern for patient care and accurate record keeping. Explanation. This scenario presents an ethical dilemma common in optometric practice, where a technician's duty to patient care and professional integrity may conflict with a supervising optometrist's instructions. The challenge lies in balancing respect for the supervising practitioner's authority with the ethical obligation to uphold the highest standards of patient safety and accurate record keeping, as mandated by the Optometric Technician Certification Exam (OT) regulatory framework. Careful judgment is required to navigate this situation without compromising patient well-being or professional ethics. The correct approach involves respectfully but firmly communicating concerns about the inaccurate documentation to the supervising optometrist, and if necessary, escalating the issue through appropriate channels. This upholds the principle of patient advocacy and the integrity of optometric records, which are critical for continuity of care and legal compliance. The OT regulatory framework implicitly and explicitly emphasizes accuracy, honesty, and patient safety. Failing to address inaccurate documentation can lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, violating fundamental ethical tenets and potentially regulatory guidelines concerning professional conduct and record maintenance. An incorrect approach would be to proceed with the inaccurate documentation as instructed. This directly violates the ethical obligation to ensure the accuracy and integrity of patient records. It also undermines the professional standards expected of a certified optometric technician, potentially exposing both the technician and the practice to legal and disciplinary action. Another incorrect approach would be to ignore the discrepancy and hope it goes unnoticed. This demonstrates a lack of professional responsibility and a failure to act in the patient's best interest, which is a core ethical requirement. Finally, immediately reporting the optometrist without first attempting to resolve the issue directly with them, while stemming from a desire to protect the patient, could be seen as an overreaction if the optometrist is receptive to correction. However, if the optometrist is dismissive or insistent on the inaccuracy, then escalation becomes the appropriate next step. Professionals should employ a decision-making framework that prioritizes patient safety and ethical conduct. This involves 1. Identifying the ethical conflict. 2. Gathering relevant facts and understanding the potential consequences of each action. 3. Consulting relevant professional guidelines and regulations, in this case, OT exam framework. 4. Communicating concerns clearly and respectfully to the involved parties. 5. If the issue is not resolved satisfactorily, escalating through established professional channels. This systematic approach ensures that decisions are well-reasoned, ethically sound, and compliant with regulatory requirements. Question 17. The evaluation methodology shows that an optometric technician is observing a patient's optic nerve head during a routine examination. The technician notes a distinct pallor of the optic disc and a significant increase in the cup-to-disc ratio compared to previous records. The patient also reports experiencing intermittent episodes of blurred vision in the affected eye over the past week. Based on these findings, which of the following actions best aligns with the regulatory framework and professional responsibilities of an optometric technician? Option A. Documenting the observed pallor and increased cup-to-disc ratio, noting the patient's reported visual symptoms, and presenting these findings to the supervising optometrist for further evaluation and diagnosis. Option B. Informing the patient that they likely have glaucoma due to the enlarged optic cup and prescribing over-the-counter eye drops to manage the condition. Option C. Dismissing the findings as age-related changes and not documenting the increased cup-to-disc ratio or the patient's visual complaints, as these are subjective. Option D. Concluding that the patient is experiencing optic neuritis based on the pallor and visual disturbances, and advising the patient to rest their eyes and avoid strenuous activity. The correct answer is A. Documenting the observed pallor and increased cup-to-disc ratio, noting the patient's reported visual symptoms, and presenting these findings to the supervising optometrist for further evaluation and diagnosis. Explanation. This scenario presents a professional challenge because the optometric technician is tasked with interpreting clinical findings related to the optic nerve, a critical structure for vision, and identifying potential pathology. The challenge lies in accurately recognizing subtle structural changes and correlating them with functional deficits, while strictly adhering to the scope of practice defined by the Optometric Technician Certification Exam (OT) regulatory framework. Misinterpretation or overstepping the defined role could lead to delayed diagnosis, inappropriate patient management, or even harm. The correct approach involves the optometric technician meticulously documenting the observed appearance of the optic nerve head, including its color, contour, and the presence or absence of cupping, as per established optometric protocols and the OT exam's emphasis on objective data collection. This documentation should then be presented to the supervising optometrist for their definitive diagnosis and treatment plan. This aligns with the regulatory framework by staying within the technician's scope of practice, which focuses on data gathering and assisting the optometrist, rather than independent diagnosis. The ethical justification is rooted in patient safety and the principle of acting within one's competence. An incorrect approach would be for the technician to independently diagnose optic neuritis based solely on a patient reporting transient visual obscurations and a slightly pale optic disc. This is a failure to adhere to the regulatory framework, as diagnosis is the exclusive purview of the licensed optometrist. Ethically, this constitutes practicing beyond the technician's scope and potentially misinforming the patient or delaying appropriate care. Another incorrect approach would be to dismiss a patient's subjective visual complaints and a visibly enlarged optic cup as normal variations without further investigation or reporting to the optometrist. This violates the ethical duty to patient care and the regulatory expectation of thorough data collection and reporting. It fails to recognize the potential for serious pathology like glaucoma, which requires professional optometric evaluation. A third incorrect approach would be to recommend specific treatment for suspected optic nerve damage, such as suggesting eye drops or advising the patient to avoid certain activities. This directly contravenes the regulatory framework by engaging in medical treatment, which is outside the scope of an optometric technician. Ethically, this is a significant breach of professional conduct and patient trust. The professional decision-making process for similar situations should involve a clear understanding of the technician's defined scope of practice as outlined by the OT certification requirements. When faced with findings that suggest potential pathology, the technician's primary responsibility is to accurately and thoroughly document observations and patient-reported symptoms. This information must then be promptly and clearly communicated to the supervising optometrist. The technician should avoid making diagnostic statements or recommending treatments, focusing instead on their role as a skilled assistant in the diagnostic and therapeutic process. Question 18. The control framework reveals that an optometric technician has completed an initial autorefraction and retinoscopy on a patient presenting for a routine eye examination. The patient reports good vision with their current glasses, but feels they might need a slight adjustment. Which of the following actions best demonstrates adherence to the established protocols for refractive data collection as outlined by the Optometric Technician Certification Exam (OT) framework? Option A. Proceed with a subjective refraction, asking the patient to compare lens options to determine their preferred clarity and comfort. Option B. Document the autorefractor and retinoscopy findings as the final refractive data for the optometrist. Option C. Immediately administer a cycloplegic refraction to ensure all accommodative influences are neutralized. Option D. Ask the patient to read the smallest line on the chart with their current glasses and then adjust the prescription based on their subjective feedback without formal lens comparisons. The correct answer is A. Proceed with a subjective refraction, asking the patient to compare lens options to determine their preferred clarity and comfort. Explanation. This scenario presents a professional challenge because an optometric technician must accurately and ethically perform a refraction to ensure the patient receives the correct prescription. The technician's role is to assist the optometrist by gathering precise visual data. Misinterpreting findings or using an inappropriate technique can lead to an incorrect prescription, impacting patient vision, comfort, and potentially leading to further ocular health issues. The technician must adhere strictly to the established protocols and the scope of practice defined by the Optometric Technician Certification Exam (OT) framework. The correct approach involves the technician performing a subjective refraction after initial objective measurements, such as retinoscopy or autorefraction, have been completed. This subjective refraction allows the patient to actively participate in determining the clearest and most comfortable prescription by responding to questions about which lens provides better vision. This aligns with the OT certification's emphasis on accurate data collection to support the optometrist's diagnosis and treatment plan. The regulatory framework for optometric technicians prioritizes patient-centered care and the collection of reliable refractive data, which is best achieved through a combination of objective and subjective methods. An incorrect approach would be to rely solely on the autorefractor's output without performing a subjective refraction. While autorefractors provide a starting point, they do not account for individual patient responses, accommodative status, or visual preferences, which are crucial for a final prescription. This failure to complete the subjective component directly violates the principle of thorough data collection mandated by the OT certification standards. Another incorrect approach would be to proceed with a cycloplegic refraction without a clear indication or the optometrist's explicit order. Cycloplegic refractions are typically reserved for specific situations, such as suspected accommodative issues or in pediatric patients, and performing one unnecessarily can lead to inaccurate results and patient discomfort, exceeding the technician's defined scope of practice and ethical responsibilities. Professionals should approach such situations by first understanding the patient's visual complaint and the optometrist's preliminary assessment. They should then follow the established protocol for refraction, which typically involves objective measurements followed by subjective refinement. If there is any ambiguity or a need for a specialized technique like cycloplegic refraction, the technician must consult with the supervising optometrist before proceeding. This ensures that all actions are within the scope of practice, ethically sound, and contribute to the patient's optimal visual care. Question 19. Quality control measures reveal a discrepancy between a patient's reported visual acuity during a routine examination and their historical visual acuity records. The patient denies any recent changes in their vision or ocular health. The optometric technician has already confirmed the patient is wearing their current prescription. What is the most appropriate next step to ensure the accuracy of the visual acuity measurement? Option A. Re-administer the visual acuity test using a different chart, e.g., as if Snellen was used or vice versa, and consider testing with a pinhole occluder to differentiate between refractive error and other causes of reduced acuity. Option B. Document the current findings as reported and proceed with the rest of the examination, assuming the patient's vision has changed significantly. Option C. Immediately refer the patient for a comprehensive dilated eye examination, suspecting a new ocular pathology without further investigation of the testing method. Option D. Ask the patient to describe in detail their subjective experience of their vision without retesting to gather more qualitative data. The correct answer is A. Re-administer the visual acuity test using a different chart, e.g., as if Snellen was used or vice versa, and consider testing with a pinhole occluder to differentiate between refractive error and other causes of reduced acuity. Explanation. Scenario analysis. This scenario presents a common challenge in optometric practice, ensuring the accuracy and reliability of visual acuity measurements, especially when initial results appear inconsistent with patient history or other clinical findings. The challenge lies in identifying the root cause of the discrepancy and implementing the most appropriate corrective action to maintain patient care standards and adhere to professional guidelines. Correct approach analysis. The correct approach involves a systematic reevaluation of the visual acuity testing process, starting with the most fundamental elements. This includes verifying the patient's refractive correction, ensuring proper lighting conditions, confirming the correct chart is used at the appropriate distance, and observing the patient's technique. This methodical approach directly aligns with best practices for visual acuity testing, which emphasize accuracy, consistency, and patient comfort. Regulatory frameworks for optometric technicians typically mandate adherence to established testing protocols to ensure reliable data for diagnosis and treatment planning. By retesting with a different chart, e.g., if Snellen was initially used, or vice versa, and considering pinhole acuity, the technician is employing validated methods to differentiate between refractive error and other potential causes of reduced acuity, thereby upholding the integrity of the examination. Incorrect approach is analysis. One incorrect approach is to immediately assume a change in the patient's ocular health without a thorough reevaluation of the testing procedure. This bypasses essential quality control steps and could lead to unnecessary further investigations or misdiagnosis. Fails to acknowledge that testing methodology itself can be a source of error. Another incorrect approach is to simply document the initial findings without attempting to resolve the discrepancy. This neglects the professional responsibility to ensure the accuracy of clinical data and could result in suboptimal patient management based on potentially flawed information. It represents a failure to uphold the standard of care expected of a certified optometric technician. A third incorrect approach is to rely solely on the patient's subjective report of vision without objective verification or retesting. While patient input is valuable, visual acuity testing requires objective measurement. Over-reliance on subjective reporting without retesting can perpetuate errors and does not meet the requirements for accurate diagnostic data. Professional reasoning. When faced with inconsistent visual acuity results, a professional optometric technician should follow a structured problem-solving process. This begins with a critical review of the testing environment and procedure. If the initial test appears valid, the next step is to explore alternative testing methods or conditions that can help isolate the cause of the discrepancy. This might involve using different charts, employing pinhole occluders, or rechecking refractive correction. The ultimate goal is to obtain the most accurate and reliable visual acuity measurement possible to support sound clinical decision-making. Adherence to established protocols and a commitment to accuracy are paramount in maintaining patient trust and ensuring effective eye care. Question 20. What factors determine the appropriate documentation and reporting of iris and pupillary findings by an optometric technician during a routine eye examination, considering potential abnormalities? Option A. The availability of diagnostic imaging equipment and the technician's ability to interpret complex ocular pathology independently. Option B. The presence of direct pupillary light reflexes, symmetry between pupils, and any noted deviations in iris structure or color. Option C. The technician's familiarity with common iris colors and the perceived speed of pupillary constriction. Option D. The patient's subjective report of vision changes and the technician's personal opinion on the significance of observed iris features. The correct answer is B. The presence of direct pupillary light reflexes, symmetry between pupils, and any noted deviations in iris structure or color. Explanation. This scenario is professionally challenging because an optometric technician must accurately assess and document pupillary responses, recognizing potential abnormalities, to ensure appropriate patient care and timely referral to the optometrist. Misinterpreting or failing to identify significant findings could delay diagnosis and treatment, impacting patient outcomes. The technician's role requires a keen observational skill and a thorough understanding of normal and abnormal iris function within the established regulatory framework for optometric practice. The correct approach involves a systematic assessment of pupillary light reflexes, noting size, shape, and reactivity, and comparing both pupils for symmetry. This directly aligns with the Optometric Technician Certification Exam, OT, scope of practice, which emphasizes assisting the optometrist in patient examination and data collection. Specifically, understanding and documenting miosis, mydriasis, and anisocoria are fundamental skills. Recognizing iris abnormalities like coloboma or signs of iritis and reporting these promptly to the supervising optometrist is a critical ethical and regulatory responsibility. This ensures the optometrist can perform a comprehensive diagnosis and develop an appropriate treatment plan, adhering to standards of care. An incorrect approach would be to solely focus on measuring pupil size without assessing reactivity or symmetry. This fails to capture crucial diagnostic information regarding neurological or ocular health, and neglects the requirement to identify potential anisocoria, which can indicate serious underlying conditions. Another incorrect approach is to dismiss subtle iris abnormalities as insignificant without proper documentation and reporting. This violates the ethical duty to report all observed findings that could impact patient health and bypasses the optometrist's need for complete information. Finally, attempting to diagnose or manage suspected iritis without direct optometrist supervision is outside the scope of practice for an optometric technician and constitutes a significant regulatory and ethical breach. Professionals should employ a decision-making process that prioritizes patient safety and adherence to scope of practice. This involves a systematic review of all observed ocular signs, comparing findings against established norms, and understanding when to escalate concerns to the supervising optometrist. A thorough understanding of the specific regulatory guidelines governing optometric technicians in the relevant jurisdiction is paramount.